In the U.S., 30% of total healthcare spending is wasted on unnecessary healthcare services. That's $750 billion lost every year. Every day, health plans, health systems, ACOs, employers, and government programs are paying for avoidable healthcare utilization, such as repeat emergency room visits or spending time in long-term care facilities instead of being home. For example, every day hospitals and medical centers care for our sick and fragile patients. But did you know that 20% of all Medicare patients are readmitted within 30 days, and 50% of heart failure patients are readmitted within 6 months? Additionally, readmissions account for over $17 billion in avoidable Medicare spending. That's because, in addition to their medical conditions, some patients face serious obstacles on their path to recovery: psychological, social, and environmental factors. Maxim Healthcare Services Community-Based Care Management Program can help. Sometimes it's the simple things: missed medication, poor nutrition choices, or lack of transportation that could lead to readmission. Maxim Healthcare Services Community-Based Care Management Program provides patients with a community health worker focused on helping patients navigate the barriers to their care, engage in their recovery, and ultimately reduce healthcare costs.
This program is needed because there are people out there who aren't properly being served by today's healthcare system. They're falling through the cracks, they're lacking appropriate access to care, and ultimately they're unable to adhere to their medical instructions. This leads to high-cost spending for the healthcare system that is potentially avoidable with the right support system.
A typical client is someone who is identified by the hospital as being high risk for readmission. We work with them to help them either with a chronic condition that they're having a hard time managing, or they may have a new diagnosis of a condition that they're having a hard time managing.
I was going back and forth to the ER, having complications, seen or unseen by doctors when you're sent home. I live alone. So to have somebody there that I know I can depend on just to help me get through these little hurdles they call life is valuable.
Maxim can address our customers' pain points associated with the non-medical factors that drive healthcare spending. For example, we have a partnership with a hospital outside of Baltimore, Maryland to reduce 30-day hospital readmissions. We do this using our community health worker team to go into the home and execute a customized care plan for that patient to keep them out of the hospital and to connect them to more appropriate providers such as primary care and specialists.
Some of the things that I help my client with in the home are transportation services, food and nutrition, budget and finance if they need it, linkage to community resources, and safety plans.
The real heart and soul of this program is our community health workers. We're able to go into the home and speak to the person as a person, figure out the issues that they have, and ultimately address them outside of a clinical setting. This patient-centered program is the future of healthcare.
My community health worker, if I didn't have her, I'd be back in the hospital. She smooths the road so I can get my pharmaceutical needs, my medical equipment needs, whatever I need to have this independent lifestyle.
This program is really changing lives. People who didn't have access to health care, people who didn't understand what type of disease they had, people who didn't know how to take care of themselves are now at a place where they're comfortable asking questions, advocating for themselves, and becoming better versions of who they were.
Maxim's community-based care management program has reduced 30-day hospital readmissions by 60%, and in doing so, saved millions in hospital variable and readmission costs. Let our community health workers make a difference in the lives of your patients. For more information, please visit the Maxim Healthcare Services website and select Community-Based Care Management.